Thank you for the opportunity to join you today and talk a little bit more about the role of WINS and COVID-19 and opportunities for control through schools. So I think it's important, when we think about kind of the role that schools play in the prevention of COVID-19 transmission, to kind of think back to kind of what we know about the larger ways in which COVID-19 is spread from one individual to another. We know that an infected individual can cough or have a runny nose, releasing kind of droplets into the air, which can then be transferred to another individual. They can contaminate their hands or surfaces, and then these can then subsequently also be passed on to another individual. Now, how schools can kind of be part of this kind of preventing transmission is they can provide ways to reduce person-to-person transmission. Schools can play an important role in reducing contact exposures, and schools have a larger role in kind of supporting local policies on contact tracing, isolation, and testing. And those are going to be in line and part of kind of national guidelines. I want to focus for the rest of kind of this brief discussion on ways that schools can contribute to reducing person-to-person transmission. And this is an important part of kind of making sure that schools are safe in reopening. And schools, we've heard before from our colleagues at UNESCO, how important schools are to the kind of overall health and well-being of everyone. And it's important that we kind of make sure that schools are safe once kind of reopenings occur. So in general, schools, there's kind of three kind of broad activities that schools can do to kind of help reduce person-to-person transmission. The first is promoting physical distancing, and we've seen many ways that this has been done kind of globally and within the school context. These include things like adding visual cues to the environment, limiting gathering spaces. Specifically for schools, these might relate to staggering schedules or time in schools, such as kind of staggering entrance and exit times to the building to avoid large congregations of students. The second is promoting adequate respiratory hygiene. And these can be things as simple as kind of, ensuring and promoting students cough or sneeze into their elbow. We can also promote the use of masks in line with local guidelines and how to do that safely among school-aged children. But an important part of this as well is the promotion and maintenance of hand washing with soap among school-aged children. And this is where I'd like to focus the rest of my discussion today. And kind of four broad categories here. This includes providing hand washing infrastructure, modifying the physical environment, providing age-appropriate COVID-19 hygiene education, and creating schedules or routines around hand hygiene in schools. So first, the main thing in order to make sure that students are able to wash hands with soap at appropriate times requires providing hand washing facilities aligned with global or national standards, such as the Joint Monitoring Program. These facilities have to have sufficient water for hand washing, sufficient soap for student use, or the use of alcohol-based hand rubs where appropriate, in line with national strategies. This may require schools to invest in and find strategies for improving in water supply and connections, for improving water storage capacity, and making sure that adequate soap and or hand rub is distributed and accounted and routinely kind of adjusted for in school budgets and local procurement. As we think through the kind of implementation of this infrastructure at schools, it's important to realize that that hand washing facilities need to be specifically designed for children and meet their needs. In particular, these facilities need to be accessible, and we need to make sure that all children can access and use necessary facilities. They need to be inclusive, and that means that these need to be responsive to different needs of students by age, gender, and disability. And finally, they need to be convenient. They need to be located at the locations where students need them and should be using them. I'll talk more about this in a minute at the end when we discuss kind of routines and schedules. The second part here is providing age-appropriate COVID-19 messages and hygiene education. As we think through the education system, for those of you coming from a WASH background or a kind of a water and hygiene background, I think it is important to kind of understand that hygiene education needs to be adapted to the specific needs of the learners. These include kind of exploratory learning for younger children, play-based learning for primary school age children, and interpersonal learning for kind of secondary age children. But overall, making sure that we design and adapt hygiene education programs to the age appropriate kind of groups that within these schools. From a learning and education perspective, this might seem kind of a non-controversial, this might seem very obvious, but I think from a WASH perspective, we often kind of try to implement singular hand washing promotion interventions without adjusting for the fact that learners are at various stages of education. Another thing we can do in terms of kind of improving hand washing with soap in schools is using cues and prompts to kind of trigger and enable hand washing with soap at key moments. Underscoring this is the fact that what we've seen globally in many studies, and particularly within the context of COVID-19, is that many students know when and how to wash their hands. We often focus on education on teaching students to wash their hands, but like many people, this is something students may already know how to do. In that case, then we may be able to take advantage of this and use small cues or changes to the physical environment that can trigger hand washing at key moments. This is often referred to in kind of some aspects of literature as nudges, which is a very kind of far-reaching field, but these are ways that we can adapt the physical environment to make hand washing more convenient and more automatic among children. You can see here some images of this. This includes using brightly colored infrastructure to grab the attention of children. We have an image in the top right of a design in Bangladesh that was proved effective in increasing hand washing with soap that involved footprints and kind of simple icons for students to see. Even the use of mirrors has been associated with increasing hand washing with soap as kind of a natural tendency for people to want to look at themselves in a mirror and see their own reflections, or kind of look at their own reflections. So these are all ways that we can kind of cue hand washing at key moments. Another part of this is kind of recreating schedules and routines around hand washing. Traditionally, we've kind of focused hand washing interventions in schools around moments related to toilet use or before eating. What we're finding with COVID-19, and important to remember, is that there's many more moments throughout the day where hand washing is critically important. This includes the entrance and exits to school grounds. So as children are coming and going, and this is very important for preventing the transmission or bringing kind of COVID, bringing infection, kind of the virus on students' hands into the school environment, or eliminating that from the school grounds to prevent community transmission. We need to ensure that hand washing facilities are available in dormitories where applicable, in each classroom if possible, and in food preparation areas if possible as well. Coupled with this is rethinking the times and moments where students should be washing their hands. As I said before, the majority of focus has been traditionally on after toilet use or before eating, but we also need to think about before food preparation, as I said, when entering or leaving school grounds. And many schools are actually trialing efforts where hand washing is repeated at regular intervals throughout the day. Many interventions focus on once per day hand washing, and we're kind of new approaches are things as often as once per hour, or increasing the overall frequency of hand hygiene. So these are just some of the ways that kind of hygiene is important in terms of preventing actions that schools can do to kind of increase hand washing behaviors in schools. And just, I know in the next discussion by Bella, we'll be discussing some of the resources and guidelines that are available to help guide this, but just want to also flag a kind of another global resource that's available right now. This is the Hygiene Hub. It's housed at the London School of Hygiene and Tropical Medicine, and a partnership with multiple international technical partners to provide technical support to agencies or governments or any actor implementing hygiene programs in response to COVID-19. We'll put the website there, but you can use this website and view resources that help turn guidelines and actions into kind of practical approaches and discuss kind of issues and questions with a whole range of technical experts.
This graph was provided by the JMP team, Joint Monitoring Program of WHO and UNICEF. A big thank you to this. And this is a sneak peek before the national, regional, and global estimates are being published. So this data shows this, and this is specifically the JMP data for the Southeast Asian region and the Pacific, and shows only now the hygiene data, because that is of utmost importance at the moment for us, because it provides the percentage of schools providing access to hand washing stations with water and soap. And as what we can see is that at the moment, this is data of 2019. Of the 15 countries with data, only 1/3 had more than 50% coverage of schools, the percentage of schools providing hand washing stations with water and soap. But as you see here, the COVID-19 has been a call to action to address these gaps. And we also now see the enormous efforts of governments in the region, and this will for sure show results. So dramatic and rapid improvements are anticipated as countries preparing to reopen schools during the crisis. Next slide. Yeah. So the network has worked on certain brief knowledge products to support the reopening of schools and also keeping schools open. So the first thing I show you here is the so-called knowledge map, and this provides links to relevant information all related to COVID-19 for learners, for the families, and also for the education system. The material, when you click this, the material is categorized into resources regarding physical distancing, hand washing, and hygiene behavior. You can also find videos and posters for learners, also for different age groups and for the teachers of the different age groups, but also material related to support WASH in schools related pandemic response interventions at the management of this for the education sector on all the different levels of education governance, for the national sector, for the subnational, but also to the school level. So this is all to be found on the knowledge map, and the knowledge map is not is constantly being updated. So I think it's already the 5th time updated. So if new things come in, they will come out in the knowledge map. And the knowledge map has been checked by various reputed organizations, so that you're sure the material you receive there is a valid and reputed material. Next slide. The next aspect the WINS network was working on were 10 immediate action points, just to see how can one really, with a huge amount of information available, how can we support schools and ministries of education down to the school level, what is needed, and guide them for the preparing of reopening of schools. And you can see we reduced it to really 10 immediate action points for school heads to manage the response of COVID-19. And you cannot see it's exactly 10 points. And it's about setting up hand washing facility, how to consider water availability, calculate supplies, how to do this, recommendations on cleaning and maintenance. 5th is on daily waste management. Then also on how to create a team on school ground to monitor that things are really happening. Aspects on orientation and training, physical distancing, and also additional detailed checklists. And very clear, this is just a rough guidance. Of course, ministries of education will fine-tune that in their way, but that is helping the direction. Next slide. And then you can see there have been different checklists being developed. And these checklists are created based on the recommendation of WHO, UNESCO, and UNICEF. They have been developed for, as you see, the school entrance, the classroom, and the toilets, and to make schools as safe as possible. Of course, there is no one fits all, but the checklists are intended just to be guides and to support the respective national guidelines, of course, and the local context. So the countries might change them a bit, adapt them to their context. And just this is an announcement. This is coming out soon, the guide on nudges to improve hand washing with soap in schools. Robert Dreibel, this is something coming from the Hygiene Hub, a team with Robert Dreibel and Julie Watson. And this is coming out soon. Keep an eye on that, because this is exactly showing the aspects Robert has also elaborated in his presentation. And with this, thank you very much.